Hi everyone. On today's episode, we'll be talking about sexual and reproductive health. And here in the house, I have with me Mrs. Ogunbayo. She's a registered nurse, a midwife, and a public health nurse. You're welcome to the show, Mrs. Ogunbayo.
Thank you, Empress.
So, talking about sexual and reproductive health, can you tell us what it is all about?
Okay. Sexual and reproductive health talks about a complete physical, mental, and social well-being of health relating to the reproductive system. I mean, it also encompassing having safer sex
Okay.
and making the right information, like getting the right information, choosing the right and making the informed consent, knowing when to be pregnant, not just getting pregnant and reproducing.
Okay.
So that's just good.
Okay, so it has to do with intercourse, pregnancy, I guess sexual related.
Yes.
Okay. So talking about, you mentioned safer sex.
Yes.
Okay, we always know that safe sex is with condoms is generally known, but we also have this. We know that a lot of people say, yeah, condoms break. So how can is there any safer method, apart from condoms, or are there condoms that are superior to the other?
Okay, now you will notice that when I said so, I didn't say safe sex.
Okay.
I said safer sex.
All right.
But you're saying safe sex, that means maybe having sex that is safe, that won't expose you to harm
Okay.
during sex.
Like
Which,
infections, right?
yes,
Okay.
which yeah, the use of condom is part of it. Prevention of infection is part of it.
Okay.
There are safer options.
Okay. All right. Okay. So condoms are actually safe. That's what you're saying. They don't break.
They do.
In case they break,
Yeah.
there are chances of pregnancy,
Yes, STIs
STIs, and
and
all of
all
that.
that.
How do people access STI care? Like, how do they access, where to get tested? These days, people just say, okay, I have toilet infection. Pia. They go run to the pharmacy. I want to get this drug. I have toilet infection. I don't know if there's anything like toilet
There's not
infection anyway.
in the book. There's nothing like toilet
All right.
infection. Number one and two. It is expected that when you have any issue, walk into the hospital.
Okay.
Tell them your complaint. Let them run tests for you. When they run the test, they will know precisely what is wrong with you. It's not about okay, I have infection. I'm going to get over the counter drug. And it's even one of the issues we're having now in Nigeria because this month you say you have that infection, you get over the counter drugs, and mostly they are antibiotics. The next month, upper month, you keep going and going, it's not getting better. And by the time you get to the hospital, they test you, they check the sensitivity to the antibiotics, you are reacting to it, meaning that they cannot treat you again with those antibiotics because your body is already used to the antibiotics and they cannot use it to treat you
Wow.
again.
So
the best thing is if you have any issue, go to the hospital, let them test you, let them know the specific bacteria that is affecting you. Then when they prescribe the drugs for you, it's not when you take it 3 days and say that okay, I'm fine again, I'm not taking again. Make sure you take the complete dose as it is written in the hospital. That is when you are making the right choice.
Okay, so just as she said, no self-medication. Whenever you have anything like you notice any symptoms that has not been there, walking into the hospital. Let me talk on that. Is it just any hospital or like maybe the Federal Medical Center or the General Hospital? Do health centers have
like we have levels? Okay. Yes, we have the primary centers, we have the secondary facility, we have the tertiary facility. Normally, when a patient has any issue, the first point of contact is the primary centers because this is where it's close to people, like it's in the community.
Yes.
So when you get there, you will get the right information. If it is something they cannot handle there, you will be referred to the secondary facility. Yeah. If it is something they cannot handle again in the secondary facility, you will be referred to tertiary facility. Right. So the best thing is work to any government-owned hospital, tell them your complaint, then they'll give you the right information.
That's actually true. I had that experience. Some people believe that until you get to the bigger ones. That's the tertiary. Because even the primary, you called it primary center. Okay, I think they solve a lot of our problems.
Yes.
So very seriously.
Yes.
They do, and people just don't know. Please walk into a primary health facility.
Yes.
If it's more than them, they'll refer you to the secondary and then to the tertiary. All right, and that. So people can actually get tested for STIs.
Yes.
Okay.
Yes.
And get tested, get medication, okay, get treated, and all of that. All right, thank you for that. At least everybody knows that they can get tested for STIs. Then I also want to ask, also talking about this reproductive health, we've heard of contraceptives.
Yes.
Okay, are there contraceptives that are safe, or are there some that are unsafe, or do people just assume that they are contraceptives when they are not? You know, people take medications. Okay, I took this. Like, I heard someone say I took ampiclox. Seriously, so they begin to say, okay, this one is not good for my body. Are they safer contraceptives, or the ones we think are unsafe are actually not contraceptives?
Okay. When you say ampiclox is not a contraceptive.
Okay.
Ampiclox is an antibiotics.
All right.
That is why the first thing I will say when there is an issue, I will say get the right information.
Okay.
And the best place to get your information is to go to the hospital.
All right.
Not my auntie, brother, sister told me this. When we are talking about contraceptives, we are talking about using of condom.
Okay.
Condom is a form of contraceptive. That's the barrier method. It's also a form of condom. We have male condoms, we have female condoms. And before I move forward, I want to emphasize this. Anything relating to health, go to the hospital.
Okay.
When you get to the hospital, you will get the right information.
That's right.
So that's by the way. So I said condom is a contraceptive. We have the male condom, we have the female condom, we have pills that we take every day by day. Is a form of contraceptive. We have injectables that women take. We have the one for 2 months, we have the one for 3 months that people take to prevent pregnancy. Every 2 months you'll be coming, or if you choose the 3 months, you'll be coming. Then we have the implants where we put in the left arm. We have the one for 5 years, we have the one for 3 years.
Like 5 years, you will not get pregnant.
Yes.
Really?
Yes. We have the one for 3 years.
Sorry, I've heard someone say she has that. Okay, I think I read it online that she still has the implant in her hand and she got pregnant. Are there cases?
There are two things involved. It's either she's at the early stage of pregnancy where where the strip could not detect the HCG, I mean the hormone in the blood before doing the implant.
Wow.
And with family plan, it does not cause abortion or it does not terminate pregnancy. So if you are pregnant and you do family planning, your pregnancy will continue to grow.
Wow.
So it does not terminate pregnancy. So I think it's one of the reasons why she said she did contraceptives, she did family planning, and she still got pregnant. And there are some people, they won't tell you the truth.
Okay.
They will just present themselves in the hospital. For an instance, when they come for child welfare, you tell them, educate them on this family planning. Come and do family planning. Come and do this, come and do this. They won't come. By the time they start noticing that, why is my body changing?
Wow.
I think it's as if it's pregnancy. They'll not come to your clinic that they want to do family plan. They won't tell you that I feel in my body that I'm pregnant, or I've been having unprotected sex with my partner since all these days. So they won't tell you, just say, now I'm ready to do family plan. So number one, when you now test them, you now know that you now see that they are pregnant. Number two, it might be at the early stage, like I said, that the strip could not detect that hormone. Your strip will be negative. Number three, it could be from the strip. It could be maybe it is expired or maybe it is exposed. So you can get a false positive or false negative regarding those strip. So it is not like, okay, everything was done right. You did family planning. Then maybe there are even some instances that persons, they will do the family planning. Then they will come back 6 months later that they feel they are pregnant. And I will tell you that you are not pregnant.
Okay.
Because 6 months now, if you are pregnant in the early stage, at least the pregnancy should be showing now. But you are telling me that after you did family plan, you are now pregnant. Then I'll tell you no. That it's very, very, very rare for such thing to occur. So they will tell you, yeah, I'm pregnant. Okay, by the time we do tests, they won't be pregnant. And then, so why am I feeling like I am pregnant?
Okay.
You are
And
not
someone
pregnant.
said all the symptoms will disappear as soon as you know you're not.
Now. So they will finally, okay, well, I'm not pregnant. So, like this set of people that you don't detect very, very early when they do this family planning, the pregnancy tends to show up now later in the day. So it's not as a result that maybe family planning failed. It's just that the circumstances surrounding the family planning.
All right. Okay, that's
Like, okay, I said we have the implant 3 years, we have 5 years
okay.
that we do at the left hand. Then we have the one we do in the service. We call it intrauterine device. We have the hormonal, we have the copper. I think the hormone is 5 years. Then we have the copper that lasts at like for 10 years
Oh,
as a form of contraceptive.
10 good years.
Yes.
Will the person be menstruating?
It depends. There are some people when they do family planning, their menstruation will be normal.
Okay.
There are some people when they do family planning, either injection, either implant, either IUD. When they do the family planning, they might not see their menstruation for a year. Some people.
And will it come back?
It will.
Really?
Yes, it will.
Okay, thank God for that.
And there are some people when they do family planning, if they are seeing their menstruation for 3 days before, it will be. It can be 5 days. It can be 7 days.
But
It can.
It's safe. It's not harmful.
We tell them when your menstruation is too much, come back. We prescribe drug for them to regulate the menstruation. So,
okay. I think we've had enough on that. So, something I want to also bring in, because I think this one also affects people in the society.
Yes.
People who are sexually harassed or molested, let me put it that way. Someone who has been planned on an unplanned sexual intercourse. So, you won't begin to look for condoms in that case if you wouldn't have the time. Yes. So for people like that, they are prone to STIs and all of that because you don't know what the other person has. And there's services that such people can get in the health facility. They didn't plan for it.
Yes.
So they may not also have the money for it, for those services.
Yes.
Is there any gender-based violence, when it comes to sex? The services are they there in the health facility?
Yes, there are. There is provision for gender-based violence. So when you walk into the health facility, there is provision for you. There is a number we will call, and they make everything like available for people who are exposed to violence or as a result of rape and all that. So there is provision for them.
Okay, to round it all up, so we are emphasizing that for anything health related, walk into the health facility, right?
Yes.
To get the right information, to get the right diagnosis, to get the right test, and to get the right treatment, right?
Yes.
Okay, so when it comes to sexual and reproductive health, people need to really pay attention to it, right?
Yes.
Because you said wrong choices could affect.
Yes.
Can it have an effect in the future?
Yes.
Okay.
Like for an instance, when someone has maybe STI, there are some STIs that are not, if they are not properly treated, could lead to infertility.
Oh wow, that's right.
That is why I said you should get the right information, go to the right place for you to get the right information and get the right treatment. If you did not get the right information, on the long run, you will see the results. So it's better you get it right in the beginning than saying, had I known, I would have gone through it. Because nowadays, we've seen a lot of people that before they get to the hospital, hey, they've tried a lot of things. It is when it is now complicated.
Hospital can solve that one.
So we now tell them that since you know that when this thing becomes complicated, you come to the hospital. Why don't you even come in the beginning so that it won't get to that point?
Please, let's go to the hospital from the very beginning.
You know that this, when it gets complicated, this is where we go. So go there in the beginning, let them solve it, and you go back to your house. Instead of getting to where it becomes complicated, you now come to the hospital. So making the right choice. If you have any issue, go to where it's just as if maybe you have a case in the court and you're asking a roadside trader that will you be my lawyer? Do you understand? Yes, just go to the lawyer directly that okay, I have an issue. What can I do? Then he will tell you. what to do.
And you get
Yes.
okay. Okay. I think we've learned a whole lot. I have learned from the very onset, go to the health facility for health, any health related problems. Thank you so much, nurse. Thank you, Mrs. Ogunbayo. So I think we're coming to the end of this. But let me just put up one more question. This question about abortions.
Okay.
You know, there are people who, well, I don't know if abortion is legalized in Nigeria. You will know that. So to health facilities, let's say someone has had it somewhere, maybe try itself, try to do it by herself, and then there's complications. Are there services to help that kind of person, like post-abortion services?
Yes, there is. And putting it outright, the law in Nigeria does not support abortion.
Okay.
So there is no law that legalizes abortion, but there is provision for post-abortion care in the facility. When we're talking about abortion, I want this to be clear because the notion is when we say abortion, it means maybe a pregnant woman walks to somewhere, then terminates a pregnancy. But medically, abortion is the termination of pregnancy before 20 weeks. Either willingly or unwillingly is considered abortion. That one should be clear there.
Okay.
So now, when we're talking about post-abortion care, it also applies that maybe abortion has occurred, it's incomplete, and it causes some complications. The services are there to help the woman. So this is where post-abortion care comes in. For an instance, if there is incomplete abortion, there is manual vacuum aspiration. We call it manual vacuum aspiration to help the woman to bring out the retained product that is causing bleeding. It's also a measure for post-abortion care. Then educating them on causes of abortion is also a form of post-abortion care. Telling them about family planning is also a form of post-abortion care. So that's what I want to state here.
Okay, that's beautiful. Well, the health facility is actually loaded. People don't just know. Please go to health center, go to health facility, go to hospital. You will learn a lot. So thank you so much, Mrs. Ogunbayo. So what will be your final message to our audience today?
Okay. What, like we said, the main point here is when you have any health related issues, go to the health centers, go to the hospital, close. I'm sure nowadays we have hospitals around, they are more close to people than before. Walk there. If you have any question, ask your question there. Don't limit yourself. The services are already there for you to access. Don't say oh, they will shout at me. Longer those days, there is nothing like that. We do work professionally now. If you ask a question, you'll be given an answer. And I think the best time to go to the hospital is anytime. Any day, anytime. When you get to the hospital, you always meet health personnel there. So it doesn't say that Saturday and Sunday the office is closed. No. Wherever you get to the hospital, you meet health personnel there to ask your question. And another thing, we shouldn't do self-medication. We shouldn't say, okay, because I'm feeling a day, because my leg is paining me, let me just go and get some drugs. No, go to the hospital, get tested. When you are tested, you will be treated. Don't just assume that this is what is wrong with me. Like we mentioned earlier, where some people think ampiclox is a form of contraceptives. No, go to the right source and get your information right. Thank you very much.
Thank you for gracing us with your presence. We really appreciate it. We've learned a lot, and I've also learned a lot. Thank you also for watching us. Don't forget, like, comment, share, and subscribe to our channel. We hope to see you again on another episode. Thank you, and have a nice time.
Bye.
Bye.